Hi, I'm Josua. I'm the CEO and one of the founders of Punktum. We're a digital health consultancy focusing on digital development, mainly in the digital health space. Healthcare is a complex market, complex by the nature of all of the involved actors, especially in the German landscape, also with lots of regulatory issues. But I think the main thing what AI can help with, and what we all hope AI can help with, is the potential inefficiencies and what we will need to reallocate the resources we have in a more smart and intelligent way. So when it comes to limitations of AI, as we see it right now is maybe in the whole topic of contextualization. I think that is still something where humans are really needed, and which is also good that humans are needed. So it's not the silver bullet to solve every problem which is out there, but that is, I think, one of the main challenges we're still facing with AI in the healthcare landscape. One of the challenges we were recently facing when integrating an AI solution into a product was the topic of false positives. We were having a big team working on the project, thinking of different cases, how the people will use it, but then at the end, when the solution met the reality, unexpected things show up, which are minorities, but when it comes to healthcare, false positives might not be harmful. When it comes to bringing efficiency into solutions, it is really painful, and that's what you need to get out of the solution as quickly as possible. The workaround or simply the learning out of it was to give it to users earlier, and even make the control group smaller to get these kind of validations and feedback quicker before putting it to a bigger audience. AI can be intimidating for many users. What we are experiencing right now in terms of in the B2B sector, especially when working with healthcare professionals, the trust is already quite high, as long as the methodology is precise and the things are prepared on a professional level. And with that, we can gain the trust of the healthcare professionals to use the solutions actually. While on the other side, the end users, which are maybe parents of kids, might not be affected at all, or might not be realizing that it is an AI solution which is running in the background. One of the very important things we try to achieve when speaking with users, speaking with customers, is simply to stay open-minded, listen, allow every comment before reacting, to incorporate the feedback and get feedback as much as you can. And then when things are unclear, ask as many questions. As we say in German, there are no stupid questions, and therefore don't be afraid if something is unclear for you of the feedback you are getting, and then always reformulating, did I understood you correctly, and then integrating it, and therefore iterating the process as you go together with the healthcare professionals or the end users in general. I think when it comes to regulation in healthcare, especially in the fields of AI and data security, it's good that we have these standards, but of course making it applicable, and as also here for us in Germany, to not overshoot but find a pragmatic way to do that. That's one of the challenges we will have or are still having, and that's something which I would wish for, that things would change. But when it comes to more regulation, I would say that with a slight no, or rather it depends. It really depends on the use case, and it needs to be that the people are informed about it, so that it not anything is hidden or under the hood, which no one can take a look at it. In the field of healthcare, I see many conservative players in the field, and a risk-averse approach, which totally makes sense, since we're talking about the life of human beings or the health of human beings. But I still think there is a great potential to take risks within a controlled space, and then to innovate based on those risks taken, to evolve and to make advancements within the field. When it comes to the let's say, autonomous decision making of AI. Just recently there has been a study which compared ChatGPT or just doctors using ChatGPT, and ChatGPT was the most precise. Of course, let's be careful with taking only one study. So there is the potential, but of course I don't see it happening so quickly, so that it will stay more in the assistant role, but that all other other aspects of AI, when it comes to writing doctor letters, etc., really those bigger levels for gaining efficiencies with AI, these are things which will grow a lot in healthcare and which we will need already, especially in the German healthcare system. I would like to see that people are not afraid of using AI and are dealing with it on a normal space, but also that they are educated and that we find good and smart ways to cope with it and to work with it, but also to make it inclusive, so that it's not the upper part of any kind of society or some IT professionals, but that it will be an inclusive approach and that we all benefit from the efficiencies we will gain. For founders in the field, I think it's always important when you want to build an AI solution to not forget who are the people you are working with and for, and to make the solution for them, get them involved as early as possible. And also, on the other hand, be open and don't be afraid to ask for feedback from anyone out there. When it comes to the AI ecosystem in Berlin, I think it is really great and probably the best in Germany, maybe not even in Europe. There is a lot of drive behind it. People want to build stuff, want to build solutions. Also here at the Merantix campus, there are many events you can benefit from, can meet other founders, can learn from professionals in the space. So I think it is really a great place to be if you want to work in that field. So we as Punktum, we work mainly with healthcare institutions like the German Heart Center in Munich, or also with the Charité here in Berlin. We recently launched a product with them which is called Diaper ID, which is in the early screening of newborns. Parents are taking pictures of the full diapers of the child, simply to analyze the color of the stool and to identify rare liver diseases, which is also part of the recommendation now in the yellow book for newborns, but also to automate that and to learn more about the correlation between the stool color and severe liver diseases, which can have severe damages to the child and of course also to the parents. And we launched the application. It's a program for 8 weeks. Right now it's a study within Charité, but the plan is to roll it out further to other hospitals. And we were helping them in the redesign and the implementation of the mobile solution and the whole computer vision process behind it.